fantastic different ideas. And Chris had been talking to us, we've been thinking a lot about HL7, fire implementation. How do we bring it forward? How do we make it a part, more integrated into our efforts? So we get to the airport, and we get a phone call. Chris can't make it. He's got some meetings. But he'll phone in. So as we phone in, and we go back and forth, the meetings turn into tests. And by the end, we sort of realized what was going on, and Chris called me the next morning, and he said, I've been diagnosed. Over the next few weeks, a lot of phone calls back and forth. And over the next few months, as Chris went through his treatment, there was a single goal that kept coming through his mind. And he put his treatment around it. He actually put his surgery schedule around it. And that was to be here with us. Because this opportunity to lead from a championship standpoint, this meant so much to him. So before he leaves the stage, I would appreciate a standing, warm support for his retirement. First of all, welcome to Orlando. And if you're figuring out how to weave your way through the convention center to find the rooms, keep that map in your head. You'll need it next year too. And as a native Floridian, which I am, which is also why I live in Colorado now, welcome to the humidity. To our members, to the chapters and communities, to the market suppliers that are here, to all the innovators that are lining the hallways and chasing each other and talking and learning and exchanging. Welcome. As you heard, over 90 countries are represented here at the global conference. Over 200 members of the press have received credentials. This has literally become a reflection of all the challenges and opportunities in health, and frankly, the world has convened here. And it's been an incredible journey. This year has had so much excitement behind it, so much energy behind it. And last year, if you recall, what we laid out were some of those global challenges that were very much a part of what we saw as consistency across the healthcare system and across each nation. An aging population, the silver tsunami, the chronic disease burden that is rising, partly because people are living longer, but also our ability to do diagnosis is tremendously improved. Geographic displacement. How do we get care to each individual, no matter where they are? And when we think about geographic displacement, this is not just a rural issue. This is an urban issue as well, because you can be right in a city, right next to a hospital, and still not gain access. A lack of actionable information. And this has been a centerpiece of what we're going to be talking about in the panel and what everyone in this room deals with on a daily basis. How do we take data and turn it into information? We talked about the challenging funding systems, the economics of healthcare. They are changing, the pressure continues to build. Last year, in the conversation with Paul Krugman, the economist, we heard that there's probably another 4 to 5% of the U.S. economy that will have to be devoted to healthcare to maintain the current payment schedules against the silver tsunami and this transition of the number of citizens producing GDP to pay for the cost of care. All of this against the backdrop of an educated consumer who's looking up every day on their phones, which I did not bring up on the stage, by the way, with the situation saying, how come I can get all these services here? Why do I even have to come in? So we took these 6 and we went around the globe and we talked about them. We talked about them in our chapters. We talked about them in our communities overseas. And there was one new addition that came in, and that was the growing staff shortages. Let me give you some World Health Organization stats stats, just two simple ones. Right now, we have a gap of over 7 million healthcare workers. We do not have enough people to fulfill the way we are currently delivering care in our encounter-based paradigm. And that's a huge challenge from an operations standpoint. And anyone in here who's tried to fill out their staff, nurses and clinicians, much less physicians, huge challenge. And that gap is growing. In the next 8 years, it will accelerate, according to WHO, to almost 14 million. So we have no choice. The economic pressure, the staff shortages, the workforce development, it all fundamentally demands that we use digital health, not just as a means of operation, but as a great equalizer. An equalizer that does allow each person to have access to the best possible health and wellness they can. So this summer, literally 3 weeks before that fateful phone call with Chris, the board of directors got together with the leadership of the WHO, and we had a conversation about these 6 and now 7 targets on a global basis. And we sort of matched up. Are we in the right ballpark? 2 nonprofits thinking about this on a global basis, the impacts of health. And the answer that came back was almost a perfect match. And then we got together as an organization, your representatives, also many of you in here, HIMSS members, and as a part of our global community of health. We said it's time to do a little tweak. Let's look at the vision of HIMSS, this organization, and let's look at our mission. So we created a new vision. And that vision is simply to fill the health potential of every human everywhere. Simple, important, and difficult. How do we do it? Well, we fell in love last year with the power of and, as you know. We took IT and we made it information and technology. And so we brought forward in our mission statement the refinement to reform health globally through information and technology. This leveraging is so critical. So as you think about what we're trying to do here, the end game, it is all about that delivery of health to every person. And if we can create an informed and empowered community of providers and innovators and individuals, then we have an astounding opportunity to change the wellness of the world. So thank you to the board, thank you to all the members that have made this our cornerstone. Now behind all this is some conversations that will be coming up. They're so important about data and information. And in the United States, we'll be talking about some I heard some new proposed rules came out recently. But around the world, we're having a lot of really tough discussions around this concept of data. And it seems to fall into 3 buckets. Who owns it? Who has access to it? And who gets to use it, and for what purposes? And I want to throw out a small framework that I hope we can all grab hold of. Ownership of data is interesting, but not necessarily relevant in all the cases in which we think about it. And I'll explain why. When we think about advanced clinical decision support, yes, clinical data, extraordinarily important. I want to be able to control that to the degree of who sees information. But what we use to think about our long-term health is more than just clinical data. It's consumer data. It's outside influences. Remember that 40% of our personal behavior impacts our health. So we have to think about this in a broader text of ownership. Because the real question is, regardless of who owns the data, the rules around who has access to that data that exists about me becomes extremely important. And then if I grant access to someone, or the owner grants access to someone, how are they allowed to use it once they have it? This is a key question. An example is if I give it to someone for research purposes, they can use it for research, but then can they turn around and sell it, as an example? So think about data and how we wrap this around our goals of using the information and the technology which are going to drive us forward in the fulfillment of our new vision and mission. Our next panel is a robust conversation about exactly that. The panelists you're going to be seeing and introduced in just a few seconds are the basic principles and sit with basic principles that are driving care at the individual level, putting both the patient and the consumer first. So, let's meet our panelists.
Seema Verma is the administrator for the Centers for Medicare and Medicaid Services. As administrator of CMS, she oversees one of the largest federal agencies that deliver vital healthcare programs to over 100 million Americans. For over 20 years, she has worked with state and federal agencies to develop policy and strategic projects involving Medicaid, insurance, and public health. Governor Michael Levitt is the former three-time elected governor of Utah. In the Bush administration, he served as the Secretary of Health and Human Services in the cabinet of President George W. Bush. Now, as the founder of Levitt Partners, he supports clients as they navigate the transition to new and better models of care delivery. Dr. Karen DeSalvo is a physician and public health expert who served in the Obama administration as Acting Assistant Secretary of Health in 2015-16, leveraging health IT and to bear on the Public Health 3.0 initiative. In her prior position, she led the health IT community as the 5th National Coordinator for Health IT, shepherding the National Health IT Interoperability Roadmap. Appointed as the first Chief Technology Officer of the United States, Anish Chopra was tasked with promoting innovation, transparency, and collaboration within the federal government. Since leaving government, he has helped the healthcare community outline ways technology can spur innovation, strengthen America's competitiveness, and advanced ways to engage consumers in their care. Ladies and gentlemen, please welcome to the stage, Seema Verma, Governor Levitt, Karen DeSalvo, and Anish Chopra.
Welcome.
I just have a quick question. I'm new to hymns. I just want to make sure there's no singing or dancing on this panel. Not very good at that, and my kids used to cry while I sang.
Of course we're going to dance.
There's a lot to celebrate on this. You don't have to sing, but we may make you dance. That's the hard part.
It's a policy, I don't dance.
By the way,
Big day.
Anisha's parents are in the audience.
Oh, isn't that nice? Mom and Dad are
Where are they?
Mom? Oh, that was us.
Right there. Okay, right there. Welcome.
Hal had to sneak him in this morning, so thank you.
That's right, that's right. It's all right, it's all a part of the fun. This has been an amazing time, and all four of you have had an incredible impact on where we have gotten to from the very beginning. We're going to walk around and talk about it from a starting point. But because there was a small announcement yesterday, I jokingly said earlier, anything new? So, yesterday some very important proposed rules came out about empowering consumers, consumer-directed exchange. Pretty bold on the proposed rules. Love to get your take.
Sure. Always say another day at CMS is another day of disruption because we're not trying to protect the status quo. The status quo isn't working for patients. So our rule yesterday really was about putting patients at the center of the healthcare system and empowering them. You know, if we look at where we are with healthcare, we are headed to spending $1 in every $5 on healthcare by the year 2026. And that's simply unsustainable for the system, for the country, for every single American. So when we look at the issue of interoperability, when I think about it, out of everything that I do at CMS, we're running Medicaid and Medicare, the insurance exchanges. But when I think about one of what I call almost like a single shot with interoperability and patients having access to their records, that's one of the most important things that we are doing that's going to have an impact on the entire system in terms of improving quality of care and lowering costs. One of the things that we haven't done in all of our efforts to lower costs is focus on patients and sort of empowering patients to be consumers of healthcare and bringing them into the decision making. And we've all had experiences with the healthcare system where we're in the dark. We don't have pricing information, we don't have quality information, and we don't have our medical record. And so that's one of the things that we're focusing on at CMS is trying to empower patients on those 3 areas. And yesterday's rules were about addressing insurance companies. Last year we put out some rules about essentially telling hospitals that they're going to be penalized if they're not sharing information with patients. For doctors, we're tying incentive payments around interoperability. And yesterday's rule was around insurance companies that have reams of claims data, which can be very, very powerful. So I think that this is important, not only for patients. When they have their data, it gives them the ability to engage more in their healthcare, to understand what's going on in their health condition, and be a better partner with their providers. For providers, it gives them the opportunity to have more complete information, to make better decisions for safety issues, avoid duplication. But then I think also for the entire healthcare system, this is sort of what we see the beginning of is a digital data revolution. Now that we have all this complete data in an era of artificial intelligence, imagine what we can do with all that data in terms of research, in terms of developing new cures and treatments.
Exciting. Now, as we mentioned, brings us up to yesterday. Governor, you started this process with the wired approach and thinking about it from a personalized care. What was in the back of your mind when you started us down this path?
I have been at this a long time, but could I say it's noted, just to stop for a moment, that on this panel you have people who served in Republican administrations and Democratic administrations. But we are here today actually unified in not only a goal, but an approach. And I think that is a profoundly important moment to acknowledge. But I think it also acknowledges that transformation is a complicated thing to do. It doesn't happen overnight. I like to say that we are 25 years into a 40-year transformative period. And nowhere is that illustrated better than in the complicated world of health IT. We had to invent it. And then we've had to work through iterative processes to learn the lessons that it takes to get to that point. We, in the course of my service, we pursued aggressively the idea that let's get language where people can begin to exchange information. And our approach was that we would try to get all of the vendors to coordinate the way their systems worked. It was the wrong approach. We now know that. It is an iterative process that we have learned. These rules now basically say, let's use the power of consumers. Let's create APIs that people can submit information in a standardized way. And by doing that, we'll see the power of consumerism reshape this. That is a transformative idea, and we had to learn these lessons. I think it was Mark Twain who said, a person will learn lessons they'll learn no other way, holding a cat by the tail. Now, I'm a cat lover, and I don't hope that didn't offend anyone. It was Mark Twain who said it, but it's a very direct illustration. We have had to learn as we have gone, and we have learned, and I think these rules, this presents a grand opportunity for us to build on those rules, on those lessons.
Everyone's trying to figure out who the cat is. which of the various actors? Don't tell anyone.
Well, Karen, you wound up building right on top of the governor's work as you came in as national coordinator. Where did you take it from that moment?
You know, when I came to Washington, it was right at that swing of the implementation of high tech. We were moving into meaningful use stage 2, which everyone remembers quite fondly, and then starting to think about a future. And I got to Washington, you know, sort of 20 years of clinical medicine and the frustration on the physician side of making decisions sometimes in the dark because we didn't have the actionable information that we needed, whether it was in the clinic or the hospital or even on call after hours, and all those frustrations for my patients who had to take off work again, take a couple of buses again to get down to see us, and also a perspective about public health from a time when we were rebuilding our community in New Orleans after Katrina and saw the importance of having data in times of disaster, but frankly, for everyday public health solutions. That's actually when I got to know Governor Levitt and really understand the importance of thinking broadly about how policy can shape the work that people want to do every day. So our opportunity